Hello, thank you for taking the time to watch this informative video regarding asthma. We'll be going over general asthma information, different medications used to treat and prevent asthma, how to recognize signs and symptoms, identifying asthma triggers, and the asthma action plan you will go home with. So, what is asthma? Asthma is a disease with symptoms that come and go, so we want to make sure when symptoms return, you know how to act quickly. While we don't have a cure for asthma, you can work with your doctor to have fewer symptoms. There are two important things that happen when you have asthma. One, the muscles around the airways in your lungs tighten. And two, the irritation from this tightening causes swelling and increased mucus production in your airways. These two things, separate or together, can make it harder for you to breathe. Asthma is not the same for everyone, so you may have some or all of the following symptoms. Cough. You may cough a lot, even when you don't have a cold, or maybe just when you are playing or exercising. Wheezing. Wheezing is the sound your lungs make when air is trying to go through tight airways. It can sound like a whistling sound. Out of breath. You may feel like it's hard to get enough air, or you are breathing fast. Chest tightness. Your chest may feel heavy or tight, kind of like someone is squeezing or pressing on it. Fatigue or tiredness. You may get tired more easily than usual. Asthma takes a lot of work. It is very important to know your symptoms so you can act quickly when they begin. We want to begin treatment as early as possible to keep them from getting worse. Sometimes, even if you act early, asthma can get worse. When this happens, you will want to see a doctor as soon as possible. Let's talk about things that may trigger your asthma symptoms. These are things that cause your symptoms to start or get worse. Asthma triggers are different for everyone. Indoor triggers can be things like dust, animals like cats or dogs, and mold. Outdoor triggers could be pollen, certain plants or flowers, or even changes in the weather. Irritant triggers are things like cigarette smoke or strong smells like perfumes or cleaning products. Or things like stress, food allergies, or a cold can be triggers too. Can you think about what your triggers may be? Now that we know what triggers are, what can we do about them? Well, the best thing to do is avoid them, but sometimes that's just not possible. So there are things you can do to lessen the amount of triggers or help you plan ahead for when you know you will be around them. Washing sheets and bedding often, avoiding carpet if you can, keeping fewer stuffed animals around and not sleeping with stuffed animals can all be helpful if indoor triggers are an issue for you. If you think or know you suffer from allergies and these are triggers, then you will want to talk to your doctor about allergy medicines. Sometimes controlling your allergies may help you control your asthma. People with asthma should never be around cigarette smoke. If you or someone you live with needs help to stop smoking, please let your doctor, nurse, or respiratory therapist know so that we can share some resources with you. Now that we've talked about what asthma is and what may be triggering your asthma, let's discuss how to treat asthma. There are two different types of asthma medicines. One is a reliever and one is a controller. Relievers work to relax the tight muscles around the airways. These medications work quickly and should be taken as soon as you start having symptoms. Sometimes reliever medications are also referred to as rescue medications. The second type of asthma medicine are controller medicines that work to reduce the irritation and swelling that happens in your airways. If you have been prescribed a controller medicine, you should use it every day, even when you are not actively having symptoms, to prevent asthma symptoms from occurring. You can talk to your doctor and see if you need to have a controller medicine. Everyone with asthma should have a reliever medicine. Common names of reliever medicines are albuterol, Proventil, ProAir, or Ventolin. It is important to know the name of your rescue medicine. It should be used only when you need it for quick relief to help with your asthma symptoms, like wheezing, cough, and shortness of breath. However, you may be directed to take it before you exercise or if you know you'll be around one of your triggers. We will talk more about this when we go over your asthma action plan. It is important to have your rescue or reliever medicine with you at all times. We will also give you instructions on how to use your inhaler and spacer correctly so that you get the most out of your treatments. If you or your child uses a nebulizer for breathing treatments, we can also make sure you understand how and when to give treatments. It is important to keep your spacer or nebulizer clean. If you need help remembering how to do that, just let us know.